Mm. Wait, we do it manually. You adjust from here. You see this ring? This ring. This one. You hold right. No, this one. This one only. This small one. Okay? So you try to get the best focus and it's recording, right?
Yes.
Okay. Done? Okay. So you see the Apexo here is very sharp, very thin, very long instruments. Okay. What's happening?
It ended. Start.
How come ended? Okay, so we continue. Clear right now? Okay, so these all the sets elevators. Yeah, we have this one, the Copland, the Warwick James, Cryer, and the Apexo. Done. So we finish all the elevators instruments.
Okay. The one that you mentioned that increases your force one, that's the Cryer, right?
Yeah, Cryer, because you see is bigger size, right? So always bigger size is magnified your force. The smaller one, it will reduce your force. So better I use this one where I don't need too much force. I want to reduce. When we use it, when we are extracting the upper eight, whereby the tuberosity is behind. So tuberosity easy to get broken. It's like full of cancellous bone. Cortical is very thin. That's why little bit force, it can break it. So I need to apply force, but with minimum amount. So I use the Warwick James. If I want to apply too much force, then I go with the Cryer. Okay, so it depends. If you are seeing it small, then that will transfer smaller force. If you see it big, this one, it will convert more force. Okay, and you see even this is sharp and tips. You know the physics law, the smaller surface, more pressure. So that's why this can give more force on the bone. Okay. Okay, so now we're talking about the forceps. Forceps also classified into two parts. Someone drinking, we're already thirsty. Mute. Mute.
Who's that?
No, some of them. Okay. Only if you want to ask, you unmute your mic. Otherwise, you keep it mute. Okay? So, next we go for the forceps. Forceps we divided into two main parts, upper and lower. How I differentiate upper and lower? When you look at these forceps, there is one very significant part between the two. When I look at the blade, at the handles, it goes in one straight line. When you look at this one, you look the hands and the blades. Okay. You look at the blades and the hands, the handles is angulated. So once you see it angulated, this is definitely for the lower one. Once you see like one straight line, this is for the upper one. That's very, very easy and simple way to identify this is upper or lower. Because first I want to know this is upper forceps or lower forceps. Okay. Once you identify this upper or lower, now you are going to identify is it right or left? Is it central incisor? Is it lateral? Is it like canine? Is it for premolars or for molars? Because different teeth, different forceps. So for the upper three, like the anterior region, central, lateral, canine, we are using one forceps. Premolars, we are using another set of forceps. Then molars, we have another set of forceps. So first of all, I need to identify upper or lower. There is angle, this is lower. Straight, this is upper. Done. Now I need to know, is it right or left? Then, is it like anterior region, is it premolar region, or is it molar? So you need to know which tooth you are going to extract. Okay. So when we are talking about the upper one, like all this is all the straight forceps. Okay. Okay. When you look at these all forceps, this all considers upper one because all these is going in straight line. the handles and the blades. You see, all is going in one straight line. Okay. Now I want to identify, this is for anterior or premolars or molars. How you identify this? When you look at the blade itself, like you see, I look at this, and I look at this one. Okay, when you just focus on the blade, forget the handles, because we already said these all three is for the upper one. Okay, so how I identify this is anterior, premolars or molars? When you look at this one, first of all, the blade is very thin and is going in very straight line between the handles and the blades. It's very straight, there is no angulation. So this is definitely for upper anterior teeth, because I don't need angulated instrument. Anterior one I can easily access. Okay. Once I go further, premolars is wider than the anterior teeth. So I need a bit wider instruments. The blade should be wider to engage the tooth properly. Same time, the further I go inside is more like inside the patient mouth, then I need more curved instrument that I need to hold the teeth with less interference from the lower mandible. Because when I'm holding the instrument, the lower mandible, it will interfere me. So I need more angulated instruments. Okay. So when you look at this one, a slight curvature is there. So this one is wider from previous one, is going in little bit straight like curvature, then is wider. So this is for this one for premolars. Okay, so it's very easy. Straight, very thin. This is anterior, finish. Little bit curved and is wider. This is premolar. More curvature and wide, very wide. This is molar. Okay. There is one more thing to identify, because when you talk about premolars, it's a single roots. Even the premolar is bilateral, but actually the cervical region is also fused, so it's considered single roots. Later it will divert to two roots. Okay. So when you look at the blades here, okay, when you look at these two blades, okay, one is going like straight, one is getting what we call it the horn. You see, this is, let me show. You see this one got horn here in this part. Give me the probe. Okay, you look at this part, you see got horn in the middle. Okay, so this horn, it helped to engage this forceps on the molar teeth, whereby there is two roots buccally. So this one, it will help to engage in between the two roots. Palatally, you will find it smooth. Okay, so this one, when I'm holding in this way, I know the roots, two roots is buccally, palatally is one single root. So I know this forceps is for upper molar left side. How you identify? Okay, straight, this is for upper, curved and wide, this is for molars. Got horn here also, this is confirmed, this is for molars. So now I know, I need to know, is it right or left? Once I see, because curvature always have to go upward. You cannot hold the instrument downward, the curvature. Always you need to hold it like in this, so the curvature, it goes upward like this. So when you see the curvature on the left side, this is left side forceps, left molars. Okay, if you can find the, if you can see the horn on the left, on the right side, this is for right side. So you see, palatal root always one root, so should be smooth and round. Buccal one is two roots, so it should have the horn in the middle. So this is for left, this is for right. Okay, both you see, both is curved and wide peak. The peak always should be wide and curved. Okay, any questions? Any questions from audience? I think they are eating.
Doctor, can you repeat?
Can what?
Can you repeat again?
Repeat.
Okay, repeat. Is it clear for you, the anterior and premolar? Anterior forceps and premolar, is it clear? Because it's very straightforward. No, nothing much to worry about, right?
Yeah.
Okay, so we don't discuss about the premolars and molars. We talk about the molar forceps. Okay, molar forceps, always you see, first it have to be more curvature from anterior and premolars. The peak should be wide. Okay, this part I think is very clear. It's not difficult to identify. Okay, Now you need to identify, is it this one for left or right side? Okay, you identify this one. When you look at the tips of the peak, you found one is very smooth, round in shape. Can you see it clearly now? One got horn in the middle. The horn always, what is the advantage? Is to engage the tooth buccally, correct? Correct, or you slept? Correct, okay. Okay, so when you look at the peak, this one always have to be on the buccal surface of the tooth. So the instruments have to be held in this way. The peak have to go upward. So when I look at the peak, I see the horn on the right side. This means for left side molars, correct? Because always we are talking about the patient's left. You see, this is the left side of the patient. So the horn have to go buccally. This horn, you see the horn? Okay? You see, I think it can close. No, cannot. Okay. So always the horn have to go buccally. Okay? So this is for the left side of the patient. Okay? When you compare with the other side, you see this is smooth, this is smooth. This is on the left side, this is on the right side. So it's mean this one for the right side of the patient. Okay? Because this one have to go buccally. Okay? The horn, I'm talking about the horn, have to go buccally on the tooth. Clear?
Yes. Yeah.
Okay, very good.
Doctor, so does that have to engage at the furcation?
Yes, because you need to engage as deep as possible, right? Once you are having the tooth, this one have to go below, behind the gum. Should not grasp on the gum, should go behind the gum, grasp on the tooth, and the horn should go below the cemento enamel junction level. Have to go in between the roots, like these two roots, so it have to go on the bifurcation. Yes. Once you are there, is when you are grasping properly. Always we have to avoid the crown, okay? So once you are there, okay. There is one, sometimes what you will see, I think, no, not this one. No, we don't have it. Sometimes you can find the horn on both sides. That's one we call it universal, where can use it right, can use it left. It's not the ideal one, because later the horn will interfere palatally, but sometimes if you are stingy, don't want to spend money, you buy one forceps. Okay? So you can use the horn on both sides, the universal one. But if you want to take ideal one, this is for right side or left side based on the horn location. Clear? Okay. Okay. Now when I'm talking about the upper, we identify anterior premolars and molars. Now, even though we want to identify the forceps furthermore, there is root forceps, there is tooth with a crown forceps. How you identify this part is very easy. This is the easiest part. You look at the peaks here. Okay, you notice one is not closed. I'm totally closing the forceps, but still there is gap. This is not defect from the manufacturer. This is designed in this way, so it bypasses the crown. You look at this one, it's totally closed. You see, it's clearly totally closed, edge to edge. Can you see it properly? Okay, so one it has gap, one it doesn't have gap. The one it has gap is mean this is for tooth with a crown. The one it doesn't have gap, which is edge to edge closing, this is for the roots only, where I'm having root stump or I already broken the crown. Clear? Okay, assume clear. So we just want to revise again. We have first two sets, upper and lower. Upper, the peak and the handle should go in one straight line. The lower should be angulated. Okay, first part. Second, for the upper one, I need to identify two sets of forceps. Okay, I need to have one for which is straight. This is for anterior teeth. Slightly curved for premolars. Severely curved, this is for molars. Okay, then anterior and premolar is very easy, very straightforward. Only I need to identify, is it like closed totally, this is for the root only, or there is a gap, this is for tooth and crown. Finish. For the molars, you need to identify the horn. So when you're talking about this, like first molar, second molar, third molar, you need to look further, this is right or left, based on the tooth. So when I am extracting 1/6, I should have the horn on this side. When I'm extracting 2/6, the horn should come on this side because the horn always buccally. Okay? Any question for the upper forceps, or we move on? Move on. Before we move on, the last one, which is very special instruments, I use it only for upper wisdom molars, for 1/8 and 2/8. We call it wisdom forceps or bayonet forceps. This is the only forceps is different from all of these. So when we talked just now about the molar forceps, we said slightly more curvature here, very wide, and got the horn here. But when we are talking about the 1/8 or 2/8 only, we don't involve it in another teeth. You see the difference? Got something special. Both got the handle, both got the peak, but this one got the neck. So this neck, it helped me to extend my peak inside the patient mouth as deep as possible, because this one, once I engage with the 8, this is sometimes interfered by the lower and I cannot see it properly. But once I'm going for, I want to go deeper further without interference, I need to use the wisdom forceps or bayonet forceps, which it have, this is the extra part, the neck. Okay? Clear? Done, finished. This one, if you want to take photo. Okay, when we talk about the lower forceps, we just mentioned just now, we say the difference between the upper and lower is the angulation between the peak and the handles. Okay, so you see all of them is getting angulated one, almost 90 degree. Okay. And this one actually got two types, the British forceps and the American forceps. I don't want to confuse you more. That one, the peak is not sideways. Like you see when you open here and close, the peak sideways. That one, the peak here is coming like this. So when you open in this way, the peak like this. So never mind, forget about this one. This is just extra information. Okay, but when we talk about the lower one, same things. We have to go anterior teeth, premolars, molars. Right or left, tooth with a crown, only root stump or broken crown, is the same principles. So you have to follow the same rules. You look at the peak, is it thin or is it like a bit wider or it is very wide? Okay, so I identify if it's very thin, this is definitely for anterior, lateral, central incisor canine, or I have it wider a bit, then this is for premolars. Or I have it very wide with horn also, then this one is for molars. Okay. The difference between the molars upper and molars lowers, except the angle between the handle and the peak, there is another difference that always you will find the horn buccally and lingually. The reason why this is got two roots, one mesially, one distally. So I can engage buccally and I can engage lingually. That's why you have the horn on both sides. So this is not universal, but this is the ideal one where I can use it right or I can use it left. So it doesn't matter, not like the upper one. Upper I have two forceps. Okay? Then the same things when you are talking about the peak. If it's totally close and attached to each other, like this one, this is for the roots. If you are seeing this one, then there is a slight gap between the peaks. That's mean for the tooth with the crown. That's the only difference. Okay? Any question? Any question here? Okay. So these actually the main instruments that you need to understand. Like diagnostic set is very important whenever you are doing treatment. Even let's say you do root canal, you are doing fillings, you are doing perio treatments. Any kind of treatment, that diagnostic set is very important that you should have it first. If you are going for any stations, okay? This should come first. Second, I'm going to do extraction. So what I need to do, I need to have my injection set. Here, okay? Okay, let's say in OSCE, let's say, not necessarily I'm talking about this OSCE, but let's say in OSCE, if there is station whereby they provide these two both syringe, you should go for this one because this is the scientific and academic one. That's I need to use it where I can minimize injection inside blood vessels. So if they provide you both, you should go for the aspirating one. But let's say if for reason they provide only this one, so never mind, I will pick this one. Okay, but if it's both provided, then please go for the aspirating one.